I'm Dr. Anuja Panicker, Professor, Department in Psychiatry. I'm clinical psychologist, and I also coordinate the activities of the Hospital Counseling Center and the Student Wellness Center. September 10th, we observe as Suicide Prevention Day. Any loss of life due to suicide is a tragedy. As we all know, it has far-reaching consequences on not only the family but also on the society as a whole. And if we are aware of early warning signs, many suicides can be prevented. If we see any changes in a person we know, for example, they may be more withdrawn, or they may start to isolate themselves from their friends, family members. We see any changes in their interests. For example, a person who's regular, punctual to work, who's regular in studies, who may be an avid sports person. A person like that, suddenly they have a less interest in those activities. A person who tends to lack interest in interacting socially with others. Increased use in alcohol, drugs, researching about ways of committing suicide, engaging in risky behavior. These are some of the behavioral changes that commonly are seen in people who harbor suicidal thoughts. Emotionally, we can see changes. For example, they may be more sad, they may have crying spells, they may look lost or they may be confused, they may not be able to comprehend, they may look like they're not comprehending things properly. And even in their talk, we could pick up. For example, they may talk about a meaninglessness in life. They may feel that they're not worth living. They may even say that they're a burden to other people or express guilt feelings. In some cases, they openly say that they want to die. So these are some of the signs that we could pick up. If a person may be harboring some suicidal thoughts. So any thought of suicide, it should be taken seriously. Because if a person expresses any suicidal thought, it's not just a cry for help, but it could be definite warning signs which we need to look into. So how can we help people who express suicidal thoughts? So one, that if you have any doubt that a family member or a friend is having any suicidal thoughts, sometimes the best way to know is to ask them directly. If a person admits that they do have suicidal thoughts, encourage them to talk about it, express their feelings. We also have to understand that a person who has any suicidal thoughts, it could be due to the intense helplessness, meaninglessness, or it could be the intense worthlessness, because of which it drives them to think that death is the only escape that they have from the stress that they're having. So encourage them to talk about their feelings, what's going on in their mind. Be with them, give them the support that they need at that time. Make sure they are safe. If there are any lethal objects around them, ensure their safety. Connect them, give them support, identify their support system, who's around them, who they are close to. It could be a family member, it could be a close friend. Identify and connect them to the support system. Encourage them to take help from a mental health professional to open up about it. And continue your support in the sense, check on them, find out how they are. It could be even after you speak to them, give them a call, visit them, or text them saying that you're also available. If we all collectively could work on identifying and helping people who may have or do express suicidal thoughts, we can actually work together in saving a life. And we could give hope to people who have such difficult thoughts.